Good? Okay, so we're sort of continuing along. I left off right about here. We went over blood and the different types of white blood cells, red blood cells, and we talked about some disorders of the blood. Then we went into the blood vessels. We contrasted arteries from veins, and then talked about capillaries and precapillary sphincters, right, and medarterioles and arterioles and venules. And then I was just getting to some of the major differences between veins and arteries. And two of those major differences are found in their anatomy and their structure of how they work. So remember, this is a vein. This is depicting a vein. Doesn't always have oxygen poor blood, so they're not always bluish purple. But in this case it is. So this would be like a vein out in the limb, like out in the thigh, for example. What is a major difference between an artery versus a vein based on their anatomy? Okay, right. So the arteries are thicker, the walls are thicker, but which specific layer is thicker proportionally? The middle one, the tunica media, that's the word I'm looking for, right? Tunica externa, media, and tunica interna. So if you're looking at a vein, it's going to have a thinner media, and it's sort of a thick externa. So we also have other anatomical differences, and that's valves. So some veins, especially in the limbs, have valves. And these are called venous valves. So just think of valves are in veins, VV. So they're positioned this way to kind of in the upward direction, so they're allowing a one-directional flow of blood, okay? And we see this especially in the limbs. Why do you think there's valves in some of the major veins, especially in the limbs?
So the blood can't go the opposite direction.
Right, so the blood can't go the opposite direction, right? Blood is supposed to get where? In the veins, where is blood supposed to get? Back to the heart, right? And so it's working against gravity in many of these cases. We're bipedal, so we walk on our two legs, right? So those veins are bringing blood back to the heart. That's their job, is to get it back to the heart. And the pressure, by the time the blood goes through the high pressure arteries and then through the arterioles, and then if they do get sent through the true capillaries in the beds, they go through the capillaries. So once they get to the venule side and then the larger veins, the pressure there is very, very low, especially contrasting the fluid pressure in the arteries. So there has to be anatomical mechanisms to help get that blood to return, venous return to the heart. Also, you'll notice there's muscles. So this would be like out in the leg or the thigh. There are muscles that are sort of adjacent and squishing up right against the veins. And this actually serves as a skeletal muscle pump or skeletal muscle pumps. When the muscles actually contract, they sort of contract and shorten, and they push against the veins. And what do you think that serves to do? If when you're contracting your muscle or walking or even just doing little squats, your legs, your muscles in your limbs are actually contracting. They're pushing, right? What does that serve to do?
Push the blood up.
Helps push the blood up, right? Helps to continue surging that blood and getting it back to the heart. Okay, so muscles press against the thin-walled veins. This allows blood to return to the heart and prevent pooling or backflow or settling down in these smaller veins out on the limbs. And I'm sure you guys have heard about things like varicose veins, right? Or circulation problems that happen typically in the limbs, and the lower limbs are most common, especially for individuals who do a lot of sitting, or they do a lot of standing on their feet but not a lot of moving around or exerting their muscles. They tend to develop things like varicose veins. That is where blood is actually pooling and kind of causing a bulging out where some of these valves and parts of the veins are. So they kind of balloon out and create additional blood vessel growth and kind of bulging out where you can see it through the surface of the skin. You can actually see them. Sometimes you can feel them and see them. And a lot of that is due to blood pooling and the lack of this efficiency of getting the blood back to the heart. So even people that do a lot of like standing on their feet, it's always good to do muscle contractions of various types, like you can do calf raises, right? You can do little squats, you can do little things where you're actually moving and contracting your muscles, because if you don't, it causes more pooling in the extremities. And that can lead to one of those things, varicose veins, also clotting. It can result in different types of thromboses or clotting in the blood because you have blood that's pooling and not surging and continuing back. And if that happens, blood clots can be really dangerous, right? They can start in one place and they can wind up somewhere else. So blood clots are also sort of a risk of that. So these help to combat that and get the blood returning to the heart. So going a little bit back into blood vessels, some of the major vessels that we talked about already relate to the heart and connect the heart to the lungs in the pulmonary circuit. Remember, there are two circulatory circuits, and what are they? Remember? Yes, pulmonary and systemic, right? So we have the pulmonary circuit, and then we have the systemic going out to the body and the head. So we went through these sort of carefully, and now this is kind of a return to see where that happens in the pulmonary circuit, which blood vessels are involved, and exactly what is happening. So I like this diagram. We're going to get more to the respiratory system in just a couple minutes. But for now, it's a recap of some of these major blood vessels. You should know all the chambers of the heart, all the valves of the heart, right? The major vessels that leave the heart. What is this? This one right here? Yep, so we would call that, specifically you can call it the pulmonary artery, but really anatomically it's the trunk, it's the pulmonary trunk that gives rise to the pulmonary arteries on both sides. I'll just put PA, okay? Notice this one branches off into two, this one eventually branches off into two once it gets out into the lungs. This one branches before it actually reaches the right lung. So pulmonary trunk, pulmonary arteries. What's this major one right here? Aorta. And actually the aorta, if you look at in lab, we have the study guide of all the blood vessels, and when you're looking at the actual heart, this is actually the ascending aorta, the aortic arch, and the descending aorta that goes back all the way down, right? So it kind of makes a literal bridge, like an arch. Ascending aorta, aortic arch, descending aorta, which gives rise to thoracic aorta, abdominal aorta, and then it splits off into the common iliac arteries. Okay, so those are sort of the major ones we talked about. Now, blood goes out from the pulmonary arteries. It goes out through all these smaller artery branches, and it leads into capillaries, tiny, tiny, thin-walled, one cell layer thick, simple squamous epithelium with a little basement membrane going around, so that gas exchange can efficiently go back and forth between, this is just showing one alveoli right here, this is an alveolar, these are the sacs that make up the lungs for gas exchange. So you can see quite readily that CO2 and O2 are going to diffuse back and forth. So now it gets picked up in a capillary, and now the capillary system goes back, gives rise to all these are actually veins, shown in red. These little small veins, venule, then vein, and then bigger veins that dump back into the left atrium of the heart. And they come back in two major veins there and two major veins there. They all dump into here, right? So there's sort of four holes or openings where they come back. What are those vessels called? Don't be tricked by the color. Even on our models, don't be tricked by the color. You have to remember the flow of blood out of and into the heart. What are those? What are those? Consult. What'd you say, Jesse? Pulmonary veins. These are pulmonary veins bringing oxygenated blood. Why? Why do you know that? How do you know that?
They're bringing oxygenated blood back.
They're bringing oxygenated back to the heart. They are delivering to the heart. That's the definition of a vein. Pulmonary veins, there's a superior and inferior on both sides. They dump in, boom, right to the left atrium. Oxygenated blood now goes down to the left ventricle, the big fat muscular part of the heart, which pumps it out the ascending aorta, aortic arch, descending aorta. Yes, does that make sense? Okay, so that gets us a little segue into the respiratory system, but recap some of the major blood vessels that are leaving and entering the heart. You should absolutely know those. And in lab next week, we're gonna dissect the heart, and I'm gonna have you make sure that you can track the flow of blood through the heart, through every single vessel and every single chamber. You should already be able to do that because it's gonna be on the exam on Friday, okay? You should know the anatomical structures of the heart, how blood's coming in, how blood's going out with the cardiac cycle. Okay, does that make sense? Is that all good? I feel like that kind of brings everything kind of back together where we started. So there's a lot of disorders and diseases of the blood vessels or the circulatory system. We've got aneurysms, where that's sort of a ballooning out of a blood vessel, sort of gets really large in size. There are deep vein thromboses, specifically of the lower limb. That's very common. I talked about circulation and blood pooling problems. That can happen. So there's a vein that gets, a thrombosis is just a clot, okay? So this is a blood clot in one of the major veins, especially the lower limb. There's also microangiopathy of diabetes, where there's damage to small blood vessels. Microangiopathies, this is small blood vessel problems or pathologies. Remember, diabetics have thicker, more sugar in their blood, so it's more viscous. They have a lot of chemical sort of differences in the blood. It makes it more like syrupy, if you will, instead of really nice and fluid. So because it's more viscous, it tends to damage and affect the smaller blood vessels in the circulation, okay? And we talked about this even with the back of the eye, the retina. The blood vessels in the back of the eye can lead to blindness, right? And also things like blood problems and disruptions to capillaries out in the limbs, right? Where it can lead to tissue death because those blood vessels, especially small ones, are getting clogged and blocked and damaged, and so they're not going to be effectively getting blood and oxygen and nutrients to the extremities especially. So you guys have heard about that, right? In diabetes, if it's untreated or very, very severe, it can lead to limb amputation or foot amputation or blindness, right? And this is part of the reason for that. And then I talked about varicose veins. Quite commonly, this is really severe. This is running down the inner aspect of the leg. It's typically also out on the thighs or the femoral region, the outer legs and the outer thigh and inner legs. The saphenous vein actually goes right through here. And that typically experiences problems with circulation and sort of ballooning out of those veins with circulation problems. And sometimes this runs in families. Sometimes people are more predisposed to getting it, but it does often go along with blood pooling and lack of proper circulation to the extremities. So there are some cardiovascular changes that happen with age. So we're going to go through age and then the effects of exercise like we always do. The age-related changes, there's a hardening and thickening of the heart valves. That can happen. So the valves get a little more thick and less elastic. There's a decline in cardiac reserve. So cardiac reserve is the heart's sort of extra pumping ability. It's reserved to have sort of this extra power or ability when it's needed. That goes down a little bit with age as well. Also, there tends to be fibrosis or scarring of the cardiac muscle itself. So there can be some fibrotic tissue. Excess fibrous connective tissue builds up, so the heart is less elastic and it's less contractile. I have a spam number that's calling right now. That's annoying to happen. Remember, this always happens. It's just rampant. All right. There's an increase in heart disease, things like heart attacks, congestive heart failure. We talked about different types of arrhythmias, conduction system problems, atrial and ventricular fibrillation, all these different types of heart disease. There's an increase in that with age. Is there a difference in heart disease between males and females in general? You guys know? You know, it's a myth that males get cardiovascular disease way more common than women, and they're sort of immune to it. That's right. Men just get it earlier, so they have more cardiac disease and issues associated with dysfunction of the heart earlier in life, so 50s, 40s, 50s, 60s. Females tend to get it later, but then their numbers sort of catch up to men. So later on, it's sort of a later onset. Also, we've talked about the way they feel the symptoms of something like a heart attack, right? A myocardial infarction, more in the neck and the throat and the jaw in a woman, much more in the arm and the chest in a man. So those are sort of myths that are perpetuated, but we know now, looking at the numbers, it's the #1 killer in the United States. So it just affects, the onset is different in age. That's pretty much it. So regarding aging, the heart usually functions well throughout life. So this means typically the heart itself, cardiac muscle fibers are pretty strong, resilient tissue. And remember, they don't really undergo mitosis. They're fully differentiated. You've got two types of cells in the heart. What are the two types of cells in the heart? And you should know the conduction system of the heart, by the way, right? If I just do like a really sloppy rendition, you've got these sort of structures that go like this, right? And by the way, you wouldn't have to draw anything more fancy than that, right? Can you tell me what that is? Like, what am I trying to show? The what?
Is it the essay note?
Yes, sir. And then I'm going to just highlight it a little more deeply here because that was super chicken scratch. Okay? SA, what does that do?
It's the pacemaker.
That's the pacemaker. That sets the autorhythmicity of the, oh yeah, you can't see any of that, so I'm just going to turn it for just a second. There we go. Pacemaker, SA node. What's that node? AV. We're just doing a little bit of review now. This is kind of going off a little bit, but that's fine. What else? What's the track of fibers that comes right down sort of in the middle between the interventricular sort of septum, inside the septum? Right here. Before it branches off, it actually goes into two, right? Remember, there's an anatomical person's name in there? Yes, it's like his, her, bundle of his. And then we've got the what? Left and right, what? You guys got to review all this. Left and right bundle branches. And then what are these little fibers that are all out here in the wall of the myocardium? Purkinje fibers. And this breaks it down to what? What do we call all this? Why do I even care about the anatomy of this? What does this whole apparatus do?
Gives life, or impulses to contract.
Okay. Yes, sort of. It keeps you alive. Yeah, okay. We call this the conduction system. These are the conducting cells of the heart. These are the ones that allow electrical depolarization to spread throughout the heart. This allows the cardiac cycle. Remember, there's conducting cells, and then there's just standard cardiomyocytes that contract. These guys don't contract. They zip, 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 send the electrical action potentials through each other, and then it spreads in a wave to all the adjacent cells. So that brings us to there's two types of cells in the heart, and those are conducting or electrically active cells, conducting cells, versus the actual cardiomyocytes, or you would call them the cardiac fibers that contract. Right? There's two types. And that's what allows the heart to actually send that electrical wave of impulses through it, autorhythmicity, keep beating, and then the ones that allow it to contract and to pump. So you need all of that to sort of work together. This system is actually quite amazing. I don't know if you guys ever just think about sort of, I'm going to shift it. If you ever just sort of think about the amazing structure of some of the anatomical things that we're learning about, how they're perfectly architectured and set to do exactly what they're supposed to do. In general, this system of cells making up this syncytium, this whole pump that works together, is quite amazing. And it's quite resilient, and it does exactly what it's supposed to do. So in general, it functions really good throughout life, right? In all kinds of animals that have a cardiovascular system like us, including humans. The problem is, if you don't treat your body well, this ends up experiencing dysfunction and damage, and it goes awry. And now you already know, in America, heart disease has become the #1 cause of death. And that is a whole body of different diseases and issues and pathologies that are associated with it. Problems with the conduction system, previous heart attack, buildup in the arteries that serve the vessels, the capillaries, the arteries that serve the heart. It's called the coronary circuit, some of those coronary arteries we talked about. If they get plaque buildup, fat, cholesterol, all that stuff makes big plaques, it hardens the arteries, causes a myocardial infarction at some point, or fibrillation of the heart. Also, there is congestive heart failure, All these things, a lot of these things, are specifically associated with what? What are the things that we know are associated with heart disease in general? Diet, okay? Diet, activity levels, so physical activity, exercise, diet, stress. How you sort of take care of yourself and your body and your lifestyle will impact the functioning of this tissue throughout life, okay? So regular aerobic exercise actually increases the strength and the efficiency of the cardiovascular muscles and of the heart, the cardiovascular fibers and the efficiency of the heart. Aerobic means getting your heart rate up, right, to a higher level for a certain period of time. That actually also helps to lower bad cholesterol levels. Just exercising and doing cardiovascular or aerobic exercises lowers bad cholesterol like LDL, and also helps to increase the good cholesterol, which is HDL, right? So it's the high density one is the good, the low density one has more fat, more cholesterol, more triglycerides that's carrying around in the blood. That's the bad one. So it helps to lower those. So again, I'm coming back to sort of the same thing that I always come back to, and you guys are a group that understands this probably than any other group of students on campus, right? Exercise is actually key. It affects your physiology and your anatomy throughout your entire life. So just by not exercising, you can put yourself in this bracket, right? And I know I have even friends, I have family, I have my dad, he had a previous heart attack. He has a little fibrillator, an electrical fibrillator that's implanted under the skin that actually, if his conduction system gets haywire or stops doing its nice rhythmicity in the right way and it starts fibrillating, so the ventricles are like out of sync and just electrical rhythms are just going around, it'll actually give electric current to his SA node to wake all that back up and get it back. It's almost like he's getting fibrillated through a little tiny defibrillator. And we have little names in our family. We go camping and stuff. We have like family gatherings and we come up with motorcycle crew like names. And now because of his defibrillator that's implanted right above this area, right under the skin, he's the Tin Man. So I thought it was funny. I came up with that. You know, the Tin Man wants a heart, right? He's all metal. It's kind of funny. My dad has metal in him. Anyways, and he had a heart attack when he was 39, 40, and then had stents put in, and then subsequently has sort of some conduction problems. Hasn't had any problem in a long time, but he has the defibrillator in just in case it fibrillates or there's a conduction problem. And I nag and nag and nag, and it's kind of amazing because I do this to a lot of people. I even give them the science. Look, do you understand by doing this? This is this simple sort of key steps. That's all you have to do. And he's, man, I don't have time. He used to be very, very active, but he's gotten more sedentary as he's gotten older. And that happens to a lot of people. They go, I just don't have time. I mean, you're going to have more time when you're dead, I guess. I guess that's one way to look at it, but this is something that is a really big factor, and it affects millions of Americans, including people in my own family. And he's a professor. He's a science professor. So I'm constantly the nag. So what can you do? This is something simple. This is my daughter doing. We did a little duathlon. It was a swim followed by a run. It's excruciating. It's horrible. I don't recommend it. We did it at the dam. Down in Los Altos. So you swim, you do this gigantic swim, and then you get to the end and you got to run. And there's no bike to break up the run because you get on the bike and usually it kind of relaxes out your legs. So we did this one. She did fantastic on this particular race. But exercise, what's recommended really, especially by the American Heart Association, 150 minutes plus per week of moderate exercise, right? So getting the heart rate up a little bit, moderate, not super high intensity. Or you can do exercise of 90 minutes plus per week of vigorous, high aerobic capacity sort of exercise, okay? Or even more than that. So this is kind of minimum recommendations. All of this, really what this helps to do, it keeps the heart beating and allowing its efficiency and its contractile ability to constantly be working, and helps clear fatty deposits in some of those coronary arteries and other vessels of your body to help maintain circulatory or cardiovascular health throughout life. So when blood is surging, the heart is pumping and surging blood at high pressures through the arterial side of the system and then returning to the venous side. You can imagine if there are fat and cholesterol and plaques that are starting to build up, and most people have a little bit of that. Regardless, you have a little bit, it tends to happen. Helps to clear that away so they don't build, they don't accumulate and stay. So that's one of the number one ways that this can help prevent cardiovascular disease risk, is aerobic exercise. It also increases life expectancy. So people who do these things, they live longer. So they have a greater longevity to their life. They actually have a longer lifespan. Okay, so that is it for finishing up cardiovascular circulatory system. Is there any questions about any of those things? Okay, and I'm just trying to sort of re-emphasize some of the things that will come up for sure on the exam. Because there's a lot of nervous system and cardiovascular stuff on the exam. Okay, so we're out of there, and now I will go to respiratory system. I'll pull those slides up right now. Documents, courses. All right. Respiratory system. Okay, did you guys see these slides already? I put those up a little while ago. I think I put them up last week. Okay. I like doing respiratory system right after cardiovascular and circulatory system, because then we're kind of continuing that whole path of looking at the pulmonary circuit and then what happens in the pulmonary circuit and how you get oxygen to all the tissues of the body. A lot of these images are drawings, straight, real drawings from Leonardo da Vinci. I always want to say Leonardo DiCaprio every time I see that. I have to like catch it. Anyways, great anatomist, great artist, great inventor, great science, early science person. And so I like looking at a lot of his anatomical images. So he's, in this case, looking at the lungs and the trachea and the bronchi that we're going to look at in just a second. So I just want to ask you, I'll start off with a little question so we can start thinking about the respiratory system. Trachea, bronchi, bronchioles, all the little alveolar sacs are out here. They're tiny, microscopic. You've looked at them under the microscope, remember? And then we have the right lung and the left lung. Notice there's some differences already at the gross anatomy level. You can see some differences between the two sides, right? What do the lungs do? Try to think of things other than only gas exchange. So I want you to sort of think about what the lungs do in general, in addition to just exchanging CO2 and O2. Okay, so take a second, just think about that. Maybe talk to the person next to you, or just brainstorm for a second, and we'll come back to this.